of the winter wardrobe this year, a face covering to prevent the spread of COVID-19. Health officials want to make sure that people are masking up in the right way in the months ahead. Fox 12's BRIDGET CHAVEZ spoke with a woman who knows the importance of this all too well after losing her father to the virus.
Lisa Crabtree tells me she recently lost her father to COVID-19 and says it's frustrating to see that some people still are not following the guidelines. OHA says your best bet for masks is to still wear these cloth ones, and if you're going to wear a neck gaiter, make sure you double up. Lisa Crabtree knows the importance of following health and safety guidelines all too well. She recently lost her father to COVID-19. She was able to spend his final hours with him.
I was in full PPE. By the time I went in, his oxygen was so low, he was basically in a coma. They kept him comfortable with pain meds, and he just gradually stopped breathing after about 6 hours. And I was able to stay with him the entire time. I got to say my goodbyes. I got to tell him everybody loved him.
As coronavirus cases continue to surge across the country, it's especially critical this winter to make sure you're masking up properly. A scarf may keep you warm, but Dr. Shimi Sharif, a senior health advisor for the Oregon Health Authority, says it's not effective for limiting the spread of COVID-19.
They're meant to insulate, by which definition they're already like holes in the fabric, and the knit of the scarf is actually much wider than the knit required to keep viruses and, droplets out.
If you choose a neck gaiter, the CDC says to double up on layers. Face shields should be combined with a mask.
Face shields, when combined with a face covering, are very effective because then it protects the wearer from touching their face, especially transmitting COVID-19 virus into the eyes and the soft tissues around the eyes.
Dr. Sharif says that OHA will be adopting the 10-day quarantine option from the CDC, but people need to continue to monitor their symptoms for the remaining 4 days.
The only thing is that we will not be extending that to congregate care settings, whereby there's an increased risk for outbreaks and transmissions. This includes nursing homes, adult foster care homes, and some others.
Sharif says it's critical for people to continue to mask up, social distance, wash their hands, and limit social gatherings. Crabtree says it's frustrating that some people still refuse to listen to these guidelines.
Just wearing a mask in respect for your community, for your friends, for your loved ones. A mask doesn't take anything from you. It just makes you look like a stronger person and more respectable to others. Whether or not you believe in it, just please do it. Make the other people that you're around feel more comfortable.
I also asked Dr. Sharif about those who've already had coronavirus and recovered. She says they still need to follow all of the guidelines, and often the second time someone becomes infected, it's worse than the first. In Northwest Portland, BRIDGET CHAVEZ, Fox 12 Oregon.